Dr. Seth, do you think there is enough scientific data? We know the Lancet study is out. It's spoken about 6 vaccines where the booster dose, even mixed use, they say, perhaps could be beneficial. But having said that, when the government takes a decision like this, it has to be sure that it is 100%. Do you think the government taking time in that light is a positive sign that they want to get it right? They don't want to take any risks at all because they want the Indian data also to back up these claims as far as safety, if not efficacy, are concerned.
Let me be not beating around the bush and be very specific. I trust my government and I trust the government experts. At this stage, the data has been shown in the Lancet is right. You give a booster, you have 6 times, and much of those vaccines are not available in India. Let's just stick to Covishield, which was tested with a booster. And that did show that 3 to 5 times increase in antibodies. Now, I must say that the roadmap has to be restructured now. This is the time when variant and vicious variants could be around the corner that we need to recreate the roadmap, and it's a fresh.
Dr. Seth, if there are vaccine updations that take place in the next few months, those who are not in the category of immunocompromised or healthcare workers or senior citizens, would you advise them to wait for the updated vaccine if at all a possibility of a booster opens up in the next few weeks?
I would not suggest that. We're going to actually trust the government on its policies very clearly. And it's going to take some time. Yes, it may take 3 months for more sort of overarching second dose vaccines. But clearly, at the moment, safety is a real issue. And if the government decided that everybody does need a booster, we would then go for the booster as is available at that particular time and not wait on and on and on for a second generation vaccine to come to us. May I just say one more thing, which I think my good friend Dr. Sareen, and I would expand on what he said. Of course, he's saying something very cautiously, but let me just say this very important aspect about the dosing of the vaccine. You will recall that the Covishield dosing of 3 months came in because of the fine balance of science and availability, where availability for first dosing was needed at that time, and therefore 3 months had shown to be efficacious. Now the equations are shifting to first dosing being given to 85%, and clearly vaccine second dose hesitancy coming in because of the gap of 3 months. World knows that 2 months is as good as 3 months, and the world is the standard of care, is a shorter dosing, and that is why I suggest that we need to go to shorter dosing without mincing any words, and I think the government should consider it if we want to second vaccine, do the double dosing as fast as possible. There is no point creating more vaccine hesitancy for second dosing as is being seen.